This video demonstrates the procedure of tracheostomy decannulation and should be used in conjunction with the OPIC decannulation clinical procedure, which contains detailed information regarding the decannulation process and necessary documentation. Decannulation is a two-person procedure. Ensure the pre-decannulation documentation is completed in the patient's medical record. Explain the procedure to the patient. Pause the enteral feeding. Prepare all necessary equipment. This should include routine tracheostomy PPE as per hospital policy, mandatory tracheostomy equipment, mouth or nose oxygen delivery system, a pulse oximeter, a dressing pack, normal saline sachet, a stitch cutter, and a waste bag. Perform hand hygiene and put on PPE. Set up the dressing pack with normal saline, dressings, and stitch cutter if sutures are still intact. Connect the pulse oximetry and pre-oxygenate the patient if required. Position the patient comfortably lying in bed with the neck in a neutral or slightly extended position. Remove the tracheostomy dressing. Clean the stoma with normal saline. If the cuff is inflated, then deflate it and suction simultaneously. If the patient has stay and/or stoma sutures, remove them. If the patient has Velcro tapes, then undo them. In patients who have had head and neck surgery, remove the tracheostomy flange sutures. Ask the patient to take a deep breath and gently withdraw the tube on exhalation.
Breathe in, breathe out.
Occlude the stoma with folded up gauze and check that the patient is able to breathe and voice comfortably.
Can we hear your voice there, Stephen?
Yes.
Fantastic.
If the patient experiences respiratory distress and/or stridor, activate a respond blue. Reinsert a new tracheostomy tube if trained to do so. Otherwise, wait for the respond blue team to arrive. Check the patient's oxygen saturation. Apply oxygen to the mouth and nose or the tracheostomy stoma if the upper airway is obstructed. Clean the stoma. Inspect the stoma wound edges, noting the size, the presence of granulation or infection. The surrounding skin can be prepared with a Cavalon swab to ensure that the dressing adheres. Apply steri strips to bring the edges together.
That one? Thank you. You breathe as normally. Your numbers are all really good. It's all done.
Yeah.
And now you probably be able to take some oral intake and speech pathologist see you 4 hours after the tubes come out. Did you have a dry mouth? Yeah. Be nice to be able to drink again. Yeah.
Fold a gauze into a small square to fit and cover the stoma. Apply a transparent adhesive film dressing to prevent air leak. Apply an ECG dot over the film and teach the patient to gently occlude the stoma when coughing or speaking for the next 24 hours to prevent an air leak.
In the beginning, just the first day.
Support.
Yeah. So can you give us a cough? Yeah, see it bulges a bit, so
Yeah.
you just have to press whenever you need to cough. Yeah.
Alright, okay.
Great.
Ensure the patient is comfortable and the observations are stable. Post-decannulation. Complete the post-decannulation documentation. Ensure that the patient's observations are done every 30 minutes for 2 hours. If there are any concerns, escalate the hospital's clinical deterioration response.